Hello, it's Dr. Dawn, Psych MD, your most influential double-boarded child, adolescent, and adult psychiatrist. I'm also internationally recognized ADHD expert and an acute mental health strategist for professional athletes. Good evening. I apologize about my tardiness this evening. I was trying to get the technology situated and it doesn't work. Or when technology doesn't work, it's not good, right? So it's only good if it works. Hi, Dr. Stephanie. Thanks for tuning in. So I'm actually on Facebook Live and IG Live this evening, and I will be going back and forth to answer any questions that you may have about tonight's interesting topic, Munchausen Syndrome by proxy, when child abuse occurs by a mentally ill parent. So thanks so much, Lee, for joining. Thanks so much, Miss Elnora, for joining. Hello. Please share this with your Facebook community. Share this with your Instagram community. Hi. Miss Blossom Flower, thanks so much for joining. I appreciate your presence here tonight. So without further ado, let's get started. So as you can tell from my promos, I actually defined Munchausen syndrome a little bit, but I want to kind of go back to 18th century so you can understand where this terminology was coined, Munchausen. So if you think about German culture, Baron was actually identified as a sir or a gentleman. And so there was a fictional character, which was based upon a real life person, Baron Munchausen, who was known to be a storyteller. And he was very animated in his stories. They contained a lot of fantasy, a lot of kind of exaggerated experiences. So like riding a cannonball, for example. So Baron Munchausen was actually depicted during the 18th century in the German culture as an infamous storyteller. However, there were authors that actually publicized about him, and he didn't really too much like that because a lot of his stories did contain fables or lies. They were very fictitious in nature, and he did not want to be known as this person. He just really wanted to be infamous for his storytelling. Now let's go forward to about 1950, 1952. Dr. Richard Osher, who's a medical doctor, psychiatrist, actually termed Munchausen syndrome. And what he found was that when he saw a few patients, he found that these patients actually intentionally were telling stories, fabricating histories in their medical history, creating symptoms that were very exaggerated or weren't even there, and would actually recommend testing to the doctors that they should get, but there was really no organic need or cause for the test that these patients were concerned about. So Dr. Archer basically termed Munchausen syndrome. Now, Munchausen syndrome by proxy was which he should be credited for. Munchausen syndrome, in a sense, or fictitious, so let me kind of go back. Fictitious disorder is found in the DSM, our Diagnostic Manual. This is a manual where psychiatrists, mental health professionals go and actually make sure that when they see their patients or their clients and they are presenting with any type of mental health concerns or problems, that they meet criteria in order to be diagnosed with a mental health disorder or illness. And so this is a manual that we live and abide by. We want to make sure that we work within the constraints of this manual and not outside of it, because this manual was designed to make sure that there were no false positives in diagnosing, or basically we were making sure that we're sticking to the tools necessary to make sure that the accuracy of the diagnosis were legit. And so when you think about how we look at Munchausen syndrome by proxy, it's actually on the umbrella of fictitious disorder. And fictitious disorder is a disorder that's a very serious mental health disorder. It actually it involves individuals, usually moms, that deceive their own type of medical condition. So these are individuals that may go to the doctor and say that they've been coughing up blood for the past hour, which actually didn't happen, or they actually took like rat poisoning or something to make them cough up blood, so that the symptoms actually present themselves when they're in front of the doctor. So either they deceive the doctors, they manipulate doctors, they fabricate their stories, or they actually intentionally cause these symptoms to happen so that when they're presenting their case in front of a professional, a medical professional, that these symptoms are seen. And they are very, of course, mentally ill in nature. These are individuals that don't know why they do what they do, but they are very conscious as to what they do. So instead of focusing on the cause, which we don't know much about, tonight I'm going to actually focus on how to recognize these symptoms. Ironically, today I was sent a case for Munchausen by proxy. So Munchausen by proxy is when a mentally ill person, typically a mom, is a caregiver of a child, and their intention is not to create illness within themselves or falsify any type of medical history within themselves, but they actually project this onto the child. So as you can see, this is very serious. This is considered child abuse. This can actually result in a child become very, very ill or sickly or even death. So the famous case that's out there right now on Hulu, there's actually a documentary on HBO, is the case of Gypsy Blanchard and Dee Dee Blanchard. Gypsy is a young girl. Dee Dee is her mother. And I'm not going to go gather specifics on the case because first of all, one, I'm not a psychiatrist on the case. Secondly, I did watch 2 of the episodes that were on Hulu, so I can comment on those because I know many of you actually sent me some messages say, hey, I'm watching this on Hulu right now. And some have also watched the actual real documentary on HBO. And there are other networks that are creating stories similar to this case. But this is a case of Munchausen by proxy, suspected. Mom, unfortunately, of course, as you can tell and as well known, was murdered. I won't go into the specifics on that just in case because I don't want to ruin it for anybody who wants to see this case. But rather, I want to focus on the illness that is suspected that Dee Dee Blanchard, the mom in the case, had. And that's kind of where I'm going to work into the facts of what Munchausen by proxy is. And if there's any questions along the way, please put them in the comment section. Again, please share this with your Facebook community, your Instagram community, and I will definitely address the comments. So when we're looking at Dee Dee Blanchard, we're looking at a caregiver who basically is a person that is mentally ill. The reason that they're actually doing these things to their child, so they're creating illnesses, they're fabricating stories, they're making their child intentionally ill, is for gratification, self-gratification, for attention. So that's very eerie, right? Because unfortunately, as you probably common sense can tell, is that they didn't receive the type of intention in a deep format or deeply rooted way that they should have received, or that they didn't find fulfilling for their needs. And so what we find in a lot of these cases is that there may be a genetic predisposition to these individuals, which means that in the case of Dee Dee, for example, it's suspected that her mom actually did the same acts as she did to Gypsy, her daughter. And or there are family histories of other mental health disorders that may be associated with this type of what we call child abuse, basically fictitious disorder. So I will get into that a little bit later, but I just wanted to kind of really review the basics. And I took a few notes so I wouldn't forget the basics. These are individuals that will recommend a doctor's medical test to include surgeries, taking out organs, prescribing medications, you name it. And it got to the point for Gypsy where she was known to have leukemia. So mom would actually shave her head, but there was really no real diagnosis of leukemia. There were no tests that would have actually stated that Gypsy had leukemia. There were no treatments. Well, let me get back. So leukemia, there were actual instances where mom had suggested that Gypsy had bilateral hearing loss, so she was wearing hearing aids. One of the major type of functions that mom said Gypsy lacked was in the form of walking, and so this girl was wheelchair bound, and she went to school up to 2nd grade. These individuals, like mom, Dee Dee Blanchard, will do whatever it takes to make sure that they're in the caregiver role, they're receiving attention like Mother of the Year, that type of attention, and they actually will isolate themselves from people who may be onto them. They may move multiple times, which in the case Dee Dee Blanchard did. She moved from Louisiana to Missouri. And their family was actually involved in Katrina. So it kind of goes along with the story that they create, that is really hard for mental providers, family members, friends to really seek out if these are falsified statements or medical consequences. So in this entrenched story, Dee Dee actually moved to Missouri because she was a victim. She and Gypsy were victims of Katrina. So why not move to another state and start all over technically? So this was a chance for her to basically connect with new doctors. So individuals with Munchausen by proxy, the mother would actually go to many, many doctors. They may actually have a lot of hospital visits, a lot of medical visits. These kids may end up being on a lot of medications of the same class, for example, trying different medications. And you can actually see this like in their medicine cabinet at home. There are medications that were actually seen in the documentary, as well as the actual movie of Dee Dee, Blanchard, and Gypsy, where mom had all of these medications that were prescribed for Gypsy. So, for example, she would give her medications to make her go to sleep. She'll make her medications to make her drowsy. She would give her medications when she had a toothache, pain medications, which actually can cause a lot of dizziness or, decrease consciousness. So you can actually see, the serious nature of this. And so basically the parents will take these kids to, the doctor. They would convince the doctor that, their child has these conditions. Now, a common question that I get is, well, how on earth could they convince a doctor that she had leukemia? How on earth could she convince a doctor that she had a gastric bleed? Well, a lot of times, so there's really good doctors out there, okay? So we should be very good in getting a comprehensive evaluation, getting a good history, making sure we talk to previous physicians. May we make sure we cover, medical histories, make sure that we look at labs, we look at surgeries, procedures that were done, we talk to family members. I mean, these are the type of comprehensive evaluations as psychiatrists that we should be doing as a standard of care. And if we're not doing it, we are bound to miss certain conditions, such as this condition. We are bound to miss it. And so it's important that we have all the information that we need, past information, in order to proceed in recommending the appropriate and safe management for any mental health condition, correct? So some of the things, and I'll go into what some of the things that, as physicians, because I know a lot of physicians or mental providers are also watching, I'll give you some of the tools that you should notice to kind of tip you off if you may be dealing with someone who has Munchausen by proxy. However, before I get there, these are kids who just kind of have this extensive medical history of all these problems. These are kids that are likely homebound. They're kids that are likely taught at home. Again, we don't want, the parent doesn't want anyone to suspect that anything wrong is happening and start kind of digging and finding out that these are falsified reports. And so again, they try to, the parent tries to isolate the child from their friendship network, from others, from family members. And so now you have a child who's growing up in an environment where the parent is controlling everything that they do. The parent is with them constantly, 24/7. They may likely evoke abuse in the form of physical abuse. When the child is kind of counteracting what the parent is saying to do or not do, the kids may not necessarily have an outlet. So you can see that in the story in the case of Gypsy, where she would sneak and get on social media and, try to, communicate with other people, or she would be found in the doctor's office, but because of the love of her mom, it was hard for her to communicate. And we really do know by her facial and nonverbal behaviors that she knew something was wrong, but it was hard for her to express it. And these were often kids who were like 5, 6, 7 years old. So, it's unlikely for a child that young to be at a developmental level where they're saying, hey, my mom is poisoning me, or my mom's giving medicine that I don't need, or my mom is giving me something that I'm sure is causing these symptoms, and it's not true, right? So that's another, cautionary concern, that these young kids are not able to basically state, kind of fight for themselves in a sense. So what we find is that the symptoms of a person who has Munchausen by proxy is that they tend to hide their kind of behaviors. They produce injury. They're very convincing. They're very reluctant to allow doctors and people into their circle. These kids may have a lot of surgical scars. They may have frequent hospitalization stays. The parent often argues with the doctor, and you can tell because the parent is very adamant about a major procedure that the doctor really finds no value for. Okay, so basically, some of the things that you can recognize doctors and mental health providers, nurses, any medical staff member, in discovering if the mom is, proposing this type of illness, is that they tend to exaggerate the symptoms and it's outside of the reality. So if the child has like a superficial scar and the mom says, yes, that's just a well-healed wound, but this is something that is, it may be infectious. I saw her pick at it. She developed a fever. She has headaches. She didn't go to school. I mean, just kind of go on and on and on about a superficial scar. It's outside or is exaggerated or outside of what is being presented. They make up histories. These are parents or moms that may actually say, yeah, my daughter's been on 5 different medications for ulcers and none of them worked. And so the doctor tries to go and find these, the history, and the mom says, well, we lived in Canada or we lived out of the country, so we don't have, access to the medical records, or it happened years ago. So it's hard for the doctor to even verify the history because they make up stories. They fake symptoms, or they have their child fake symptoms, in other words. So they prep their child, they let their child know how to respond, how to act. They may actually be very in close proximity. They're likely very, very close to the child. And in mental health, as psychiatrists, as therapists, we actually like time away where the parent is out of the room and we have our own time with the child, so we can actually engage with the child alone. These are parents who are very adamant about not leaving the room and may suggest, hey, my child is not good when I'm not out the room, and then fabricate a story about that and really exaggerate that to where the doctor is finally like, okay, feel free to stay, but I really want to talk to your child and direct, your child. So it's kind of like a push back and forth, but they're very, very adamant. They're very, very adamant, and they may manipulate the situation. They may actually hold their child's hand. They may hold it hard or squeeze it hard as a identifier to the child of, okay, don't say anything, I'm answering this question. So these are kind of prepped conversation that parents usually have with the child before they go into the room with a mental health provider or a medical provider. They actually cause the self-harm, or make sure the child either causes self-harm unto themselves, or they actually cause the harm unto their child, unfortunately. So they may be causing these superficial wounds, or may actually be giving the child a medication that is definitely a bad medication to give for someone that doesn't need it. A common one that you may hear about is insulin, for example, insulin shots. And that actually will swallow up the glucose, and then a person may become hypoglycemic, may become dizzy, may develop a sense of self-consciousness, and may actually pass out because they don't have enough glucose in their system, which are sugars, for example. And they tamper medical evidence. These are parents who may actually steal prescriptions. They may try to tamper with prescriptions. They may get their medical history from the doctor and tell the doctor, well, we don't have access to it anymore, but here's a copy of it. And they may actually have tampered with the medical information that they've received, or may make up medical information. So again, it's very hard to identify, these ill parents. Risk factors, usually they're moms, they're women. Usually they have a child history of personal trauma themselves. They usually have a family history. Usually their mother did the same thing that they're doing or evoking to their child. They experience a loss of a loved one, a close relative that they considered to be like a guardian or very close to. They may have a poor sense of self-esteem or self-identity, poor self-confidence, and they also may develop eventually into adulthood, may develop a personality disorder like narcissism or antisocial personality disorder, or histrionic personality disorder. So there's so many disorders that, and also mental health conditions that have been associated with this disorder, such as depression, anxiety, post-traumatic stress disorder, OCD. They desire to be associated with doctors. They want to be known by doctors because of this sense of admiration. Some of them may say that they self-discovered their own child, so take the role of a doctor and say, hey, doctor, you didn't figure this out. I did. This is what my honey has, my child has. Run the test, and so on and so forth. Yes, this child has, low blood sugars and may have, a pancreas tumor that's producing insulin, whereas the parent is giving the child insulin, for example. And they usually have access to medications, prescriptions, medical care. They know medicine very well. They're very highly intellectual, know it in and out in order to be deceptive. So these are typically mental health professionals, not mental professionals, but excuse me. I don't want to stereotype any groups, but we have found that there may be a number of nurses and some medical professionals that actually may be moms who are actually, affected by this disorder. So complications, death of a child, loss of limbs, injuries, in the case of Gypsy, and again, I'll get to this later. I don't want to jump ahead of myself, but there's some really, really good, I would say, tools that you can use to recognize if this is outside of the norm, if someone is fabricating a medical history, just using common sense, or, kind of using Google, or, getting the mental health professional or other doctor's opinion if things are within reason of a medical condition. So diagnosis. Well, the thing about this is that as we know it, this may be a rare disorder. However, as I just stated, I was consulted on a case about Munchausen by proxy today, ironically, today. This disorder, we really don't know how common it is. We really don't know, because these are individuals we are less likely to see in our office. These are individuals that are very deceptive. They don't think they have a disorder. Even though they know what they're doing, they don't think that what they're doing is wrong. So, just think about the complicated nature of this illness and how it presents itself, and how there's so many conflicts that can occur within oneself that has this, or within a child where, the mom is evoking these symptoms on. But doctors, mental providers, pediatricians, internal medicine doctors, please pay attention to the following tools or kind of signs that may be, kind of red flags for you in order to suspect that there may be someone dealing with this. One is that a personal history or medical history just doesn't make any sense. Surgery, 2 surgeries in 1 month, 3 surgeries in a month. There has to be a recovery period, right? Medication that was tried 3 days back to back. Well, in mental health, some medications take at least 4 to 6 weeks to work. The medical histories just don't make sense whatsoever. Tests are ordered for what reason? There has to be reasons, self-indicated reasons, in order for insurance companies to cover it usually. These are people or moms that pay for things outside the pocket, so they're not, managed by insurance. And so, you want to look at that. You want to see if the story is believable. If there's any inkling that it's not, maybe it's a sign. The illness doesn't follow the usual course of what the parent's saying or suggesting that is happening. Doctors, we know this inside and out of what specialties we provide and type of medical illnesses and diseases that we treat. And if this is kind of your specialty, and you know that they're coming for a GI bleed and you're a GI doctor, but it just doesn't make sense, another sign. There's a lack of healing for no apparent reason. So time has taken its course, treatment has been done, yet that wound is still there, another sign. Contraindicated to the reported nature of the disease. So yourself that a person can develop headaches if they have something going on in their foot, for example. These are 2 separate symptoms that are less likely to occur together, another sign. Okay, or if the person is caught or lying when they're giving their history, or if they're caught in the act of saying something that's not true, and for a fact it's not true, that's a sign as well. So those are some of the things that you can notice. Now, again, these are individuals we don't necessarily see because they're manipulative, they're deceptive, they're intentionally causing harm to their children, yet they're trying to escape anyone from, from themselves getting found out. So what is the treatment, for these moms, well, it's very difficult to treat because, one, we really don't know the cause of this illness. Unfortunately, we don't know where it comes from. We don't know the cause of it. We know that there's a genetic predisposition to it. We do know that there are specific signs and symptoms that are part of it. We just don't know what caused it. So that's why it's important to educate yourselves about this. Have these type of conversations and share these with your Facebook community, IG community, your family, your loved ones, when you suspect that something's not right, but you don't know what it is. Again, another sign. So, treatments consist of having supportive people around them, doctors, primary care. Usually the primary care doctor, the pediatrician, or the internist is the person that is going to be kind of the leader of the team. This is the person that is going to likely consult psychiatrists like myself and say, hey, I have this history of a 22-year-old woman. She has a mother of 3. Two of her children are deceased. One is chronically ill. And this chronically ill 5-year-old has had 10 surgeries. He's had multiple injuries to the bones, multiple broken bones. He's not been in school. He doesn't have any friends. There are many family members I tried to speak with, giving mom's permission. They don't know a lot about his medical history. I tried to get in touch with doctors, but mom says that the doctors, medical records not available because the doctors, basically shut down their practice, or they're coming from out of the country. Again, it's hard to attain a lot of information about, these kiddos. And so, primary care doctors are usually the ones that are the first lines to suspect something's not right. Then they'll get teams involved. So that would consist of usually a psychiatrist, a therapist. And therapists for treatment can be helpful because they usually get down to the deeply rooted nature of what's going on with that person, what's going on with that parent. Does that parent have a traumatic history? Were they abused? Were their parents doing some type of the similar behaviors? And if that person becomes a little bit more open about receiving help, of course, that's when help works, right? But typically this type of personality that these women, unfortunately, usually women, do not necessarily seek help because they don't think that anything's wrong. And I'm repeating myself just in case that you missed it the first time, because again, these are signs to notice if you're suspecting this condition. Medications are often used to treat common coexisting mental health disorders that are associated with factitious disorder or Munchausen Syndrome by proxy. So a lot of these individuals may develop depression, anxiety, and so antidepressants, anti-anxiety medicines are often used. A lot of them may not be able to sleep, may have impulse control problems, so there are medications or behavioral management that may be used for those things. And when it's come to the point where either they really harm themselves, which is Munchausen or factitious disorder, or harm their child, Munchausen by proxy, or whatever child or that they're the guardian of, then again these individuals are hospitalized because they're actually, this is severe. Someone can actually really suffer from this condition. Again, it can result in death in some cases with children or with this, individuals themselves. So it's taken to be very, very serious. And so hospitalization is often a treatment for those type of severe cases. I actually will be including in the comment section, and I tried to do this before, but in those who subscribing to me, if you can, in Facebook Live or IG Live, if you want documents or kind of a guide, it's a tip sheet for you and how to prepare to help your family or friends where you suspect that this condition is likely. Or if you want to know more about the condition, please feel free to put that in the comment section, and with your information, and I will definitely share that with you. If you are part of my subscription on my website, you will get this information this week for sure. If you're not subscribed, or if you just want this document, please feel free and mention that, because again, this is how we're able to achieve knowledge and understanding about mental health conditions that we usually not talked about. We don't know how common or uncommon they are, because of the nature of the condition and the less likelihood that these individuals will seek help. So we need to talk about it, because again, it's very, very serious condition for the individual or for the child themselves. I want to talk, and again, I thank you so much for joining. Want to acknowledge people that have tuned in. Lati, thanks so much for joining. Hi, Dr. Vital. Thanks so much for joining. Kizzy. So Dr. Vital says that Dr. Dawn saw this while in school with one of my classmates. Yes, Dr. Vital. Thanks so much for mentioning that. And so, even, you're seeing this with a colleague, and the colleague may themselves have exacerbated their medical conditions, put them, be in a place where they're making themselves ill, again, in order to seek attention, And that's where the therapist really, really does their work, is to why are they doing this? Again, we don't know the common causes, but we do know the associated risk factors, one being trauma, neglect, abuse. So if we know that that's to be the case with certain individuals who, exhibit these features or these symptoms, then that's kind of where we're going to start, right? Especially the therapist. They're going to start working with them on that part of their life, and try to better understand what the person's been through in their situation and how they're thinking about things. Kizzy says, how were they doing surgeries to this girl without medical proof? She couldn't eat and things of that nature. Good question, Kizzy. So I know that this story is going to become more into fruition as you continue to watch it, because it is a docu-series on Hulu. So there are 60-minute episodes. If you watch the HBO feature, there is a real life documentary where they interview the real doctors that were involved, social workers were involved, family members, Dee Dee's parents, the mom, who's Dee Dee, her parents, her stepmom, her dad. They interviewed her ex-husband. So, they actually, kind of did their part and tried to understand, Dee Dee and her lifestyle, and trying to make some sense of why she was doing this to her daughter for a number of years. So what you'll find, Kizzy, and I'll just speak on in general cases, you'll find that there are certain things that moms can do if they know medicine, to basically cause surgeries in their kids. So for example, rat poisoning. Rat poisoning causes bleeds in a person's, digestive system. And so when you give rat poisoning, there's a reason why there's cautionary things when, you buy household products, for example, because if and you see kids and you see like an X on the kids, because if they don't know, they're not in that developmental age to recognize what's, good to drink, what's healthy to drink, and you're intentionally giving these to kids, okay, you're actually can create some serious medical conditions, because they're not necessarily giving them in small amounts. Dee Dee was known to overdose, go beyond. So she was neglecting the healthy state of her daughter, but she wasn't neglecting her by not being there. She was basically controlling everything that her daughter did, everything she received. She even received a GI tube, right? And Kizzy, I think that's where you're coming to, is because, she even got the daughter to say that she wasn't eating. She didn't have teeth for a period of time. She was fitted, she actually went to the dentist. And because she didn't use her teeth, she didn't brush her teeth were rotten. So she had to get all her teeth taken out. But she didn't use them because she had a GI tube. And how did she get a GI tube? Well, because she wasn't eating. Why wasn't she eating? Well, mom probably gave her some things to make her, like cyproheptadine, which is a common antihistamine that I provide for kids when they're not eating, when they're taking stimulant medications for ADHD. So what it does is an appetite stimulant. It actually stimulates their appetite. It allows them to want to eat. And so contrary to that, there are other medications that don't want you to eat. side effects of medications that don't, make you not want to eat, and just basically telling her daughter that she's not hungry, or giving her little samples here and there, telling her she's allergic to sugar. I can go on and on about this. There's so many reasons why it points to diagnostic tests being wrong. And when we run these tests, we're seeing that the child is deficient in sugar, maybe because mom gave her insulin, or the child has lost, 10 pounds in what, let's say 3 weeks, because mom literally has been abusing the child and has not been feeding the child. So they even look sickly because they haven't been eating. So they're creating situations to where on labs or on clinical presentations, we're running these tests, they are proven to be true. And so some of us treat based on labs. Some of us, like psychiatrists, treat based on clinical evaluations and assessments and labs. And so we don't know what's right from wrong. We're actually going on the honorary system that when the parent is presenting themselves, that they're telling the truth about their child's medical history. We never typically first consider that the parent is mentally ill and has this disorder and is, intentionally lying, but doesn't really know why. And so, so to answer your question around my way, Kizzy, or directly, excuse me, is that we're really seeing the results of these on tests, on exams. And so a lot of doctors are treating what they see. Now, where you start to recognize a concern is in the repetitiveness of it, in the routineness of it. So this is not just a child who goes to the hospital 3 times over a 10-year period. This is like the child that goes to the hospital 3 times within a month. And then the next month 4 times, and the next month 1 time, and the next month 3 times. So it was known that Gypsy went to the hospital, I believe, over a 3-year period, over 100 times. And they went to different hospitals because maybe someone was catching on to mom, maybe mom got suspicious, so she's going to go to another doctor. Now, the other part about this, Kizzy, is that, when mom presents these medical, let's say Kizzy got a G tube because she wasn't eating. It was on test that she was very deficient in all these nutrients, all these minerals and vitamins. And the best way to make sure she doesn't further decompensate is to put a G tube in for temporary means of feeding. Let's say mom just takes that part of the medical record, okay, goes out of the country to another state in Canada, or, in Canada, and says, hey, this is what happened. And she got a GI tube. Please continue this. This is her condition. Now, this is kind of where we come into play, and as doctors, nurses, mental health providers, medical staff members, listen to me. It's the standard of care, especially for psychiatrists and therapists, that when a person presents themselves, we ask for medical history. And if it goes beyond reason, or if you're suspecting that something's not right, that you follow up with their other doctors that they received care from, okay? In this case, many of the doctors didn't follow up with each other. They just continued the cycle. They just heard the mom's kind of complaints and just continued without even follow up. That's very scary, very scary. Now I'm not saying all doctors do that. I'm not saying majority of doctors do that. I know doctors that are very good doctors. I know doctors that majority of them are very good doctors. They practice standard of care. They practice empathy. They really do genuinely care about their patients. They're going to follow up. They even take work home to make sure that they're doing whatever they can to make sure that their patients receive the best care possible. But as doctors, we also have to be consistent with all of our patients. So I recommend following a standard of care for all your patients. Make sure you do your checklist. Make sure that you're talking to people to obtain collateral histories, because that's where we're going to find these type of cases. Make sure you look up certain labs. If you can't find them, that's a problem. State of Texas, the office is supposed to have your medical record for 7 years. And if the doctor is still open and they don't have any record of you, that's another thing. These individuals, these Munchausen or fictitious disorder individuals, tend to go by fake names and fake addresses. And so, if these red flags are coming up, if the story's not making sense, it's something to consider. Okay, something to consider. Okay, so I think it's a very good question, Kizzy. I think there's a lot into that question because there's so many cases that actually present a little differently than others. But what's consistent is what I just stated. You want to make sure that everything's consistent and matches up with medical conditions, that there's not an array of tests and medications that this person is on, and so on and so forth. Lee, how is Munchausen syndrome by proxy diagnosed? Good question, Lee. It's usually diagnosed by a primary care doctor, a psychiatrist, a person that is clinically trained to recognize that this is a disorder. So usually mental health disorder individuals may make the diagnosis. It involves us really getting their history. So again, a lot of these individuals fake their illnesses, they fake their names, they fake if they have medical conditions, they fake their wounds. So again, we go by clinical scenarios, we go by clinical presentation. So we go by observation, and we go by getting a history from the patient, as well as getting permission to talk to extended family members, teachers, so on and so forth. So we gather information from all those resources. We gather information from other medical expertise doctors, and we suspect Munchausen by proxy when it just doesn't make sense, when it's unbelievable, or the presentation is inconsistent with the actual injury, when it doesn't follow its usual course of treatment, when the wound is not healing, if it's an open wound, if the person is resistant for us to get information to continue care, or if they're caught in the act of lying or fabricating their stories. So, for example, for ADHD management, I test everyone who has ADHD. If it's a child, we get rating scales, or they get tested. If it's an adult, they come in with testing. I do not continue medication management with a person who's been previously diagnosed with ADHD unless they have been officially tested. And that's kind of my rule of thumb. And so that's how I actually go about making sure that the person is appropriately tested, they're officially tested. This is a likelihood of being diagnosed with ADHD, and therefore is less likely that they're going to be harmed in the way of treatment, because we do have a official diagnosis. So again, that's what I recommend for doctors, to make sure you follow a protocol, make sure you follow it every single time, so these type of stories don't, seep through. Okay. Hi, Dr. Jared. Hi, Lady Addie. Thanks so much for joining. Hi, Jalise. Hi, Sarita. Thanks so much for joining. Hi, Reverend Harold. Thanks so much for joining. Dr. Grant, thanks so much for joining. So I'm going to IG Live. Thanks so much for joining, everybody. Gerald, Miss Blossom, Fit Pede, MD, Kaya, Dr. Stephanie. Thanks so much, Candace. If I acknowledge you, Bayou Cowboy, thanks so much for joining. So there's a question. Dr. Stephanie asked, does it have to be a child? What about to seniors or disabled individuals? Great question, Stephanie. No, it doesn't have to be a child. So by proxy means a caregiver is taking care of another individual. So it could be an elderly person who cannot fend for themselves, who cannot take care of themselves. They're being dependent or counting on another person to take care of their medical needs, their essential needs like feeding, washing them, bathing them, just really providing the essentials to activities of daily living. So it does not have to be a child. It's actually a caregiver who evokes harm indirectly or directly to a person that they're the caregiver for. And so that's a very good question. So that's a question, and that's actually, and I'm glad you brought that up, Dr. Stephanie, because it's important even for geriatricians. So these are internal medicine doctors whose patient populations are the elderly, or geriatric psychiatrists, for example, or anyone who deals with the elderly population, nursing home, for example. These are kind of where you come in, and these are common histories that present themselves within the elderly population. And it can be, again, just like in a child who you can't depend on to feed themselves when they're 5 years old and to cook their food or whatever. Same thing for an elderly who has lost the dependency of being able to provide for their essential needs. You're seeing some of the very similar symptoms in them that you're seeing in a child. Okay, very good question, Dr. Stephanie. Thanks so much. But it is usually a child that we do see in these cases. I'm not aware of any cases that come to mind where I did see an elderly person as being a victim of this type of condition, but it's usually a child. It's usually a child. Okay. Thanks so much for asking. So Dr. Fitped, MD, I'm a pediatrician, and when I get a new patient with multiple illnesses, I request medical records. Yes, Dr. Fit, MD. Thank you. If there are none, then I start referring to specialists to start a new evaluation. Awesome, awesome technique to use, Dr. Fit, Pete MD. Thank you so much for bringing up how you go about, making sure that you're engaging patients in the manner where they're protected. You discuss how you go about making sure you get their medical history, which is important. If you're seeing, especially if you're seeing signs of medical illnesses, medical procedures that they've done, and you're probably talking to these specialty providers or referring them to start a whole new entire investigation. Now, when you do refer them, people that can actually fulfill this goal or this need are independent evaluators, for example. So there's a such thing as an independent evaluator, physician, psychiatrist, that actually will be in the role of kind of taking, gathering information from medical doctors, family members, the patient themselves, past tests, past labs, and making sure that the pieces of the puzzle fit, that the story makes sense, there's no holes in the stories, there's no gaps, and if there are gaps, that they're not, gaps where it could cause some harm or evil, that things make sense and procedures done, are helpful. So independent investigators actually spend quite a large amount of time doing this as one of their roles. And so if that's someone that, I would definitely recommend you seek out if you're suspecting that your patient or your loved one or friend may be dealing with this condition. Okay. All right. Hi, Dr. DB. Thanks so much for joining. Hi, Gina May. Thanks so much for joining. Any other questions? Hi, Misha. Thanks so much for joining. Hi, Michelle. Thanks so much for joining. Harold says Dr. Dawn is definitely one of Flint, Michigan finest. Thanks so much, Reverend Timberlake. I really appreciate you joining. And I appreciate the accolades. I'm just here to serve and, really just promote awareness and education about mental health disorders. And the reason why I picked this one was because of the current story that we are familiar with Gypsy Blanchard and Dee Dee Blanchard. In the murder, the unfortunate murder of Dee Dee Blanchard, who has been suspected of having Munchausen by proxy, and Gypsy, was her daughter. You can find this story on Hulu. If you subscribe to Hulu, I think they give you a free month free if you want to see the story. There's also a documentary on HBO, and I believe there's other networks like CNN, Dateline, that have actually interviewed different family members of this family. To gain a better understanding of what was going on between Dee Dee and Gypsy and what was going on within Dee Dee. So some of the things that I want to kind of close with is that, again, just kind of rehatch. This is a condition where a person is not just going out there and has a reason to lie. This is not lying to meet a secondary gain. This is not lying so that a mom can get a paycheck for her child. There's no secondary gain that's been identified by this. Fictitious disorder is in a completely different category than malingering. Okay, so that's the difference. Fictitious disorder is basically intentionally creating harm, medical conditions, illnesses, pain on, by proxy, on their child or on a person they're caring for, in order to gain attention. And so these are individuals who may be rather emotionally unstable. They often are suspected to maybe have bipolar disorder, depression, anxiety. These mental health illnesses are often comorbid, so they often occur in addition to the Munchausen by proxy, but not the reason for the Munchausen by proxy. Got the difference, right? So Munchausen by proxy is the primary condition. These are individuals who are usually moms. They usually have access to medications, medical care. So a lot of times we find, in what we know for those who've been impacted, that they, from the medical field, are nurses more commonly, but that's not necessarily the case for every case. And they are very, very, they know medicine. They know what insulin, giving too much insulin does. They know what giving rat poisoning does. They know the timing of it. They know what common symptoms are resulting in it. And they're very deceitful. They're very manipulating. They don't personally know why, though. They don't know that it's because they want attention. Okay? They don't know it's for that type of gratification. They just do it. And you can present tests, evaluations to prove them wrong. You can present, their past medical history saying, hey, this doctor says you don't have it. And they can read it for themselves. They can read it out loud. They can't even understand what they read, but yet and still they think they're doing their child a due service and still intentionally harming their child. So this is a very scary condition. It's a very serious condition. It is happening in our society. If you're just joining me, I was just sharing that I was just consulted on a case today for suspected Munchausen by proxy. I did with one other case in my residency or fellowship. I can't remember when it was, but that's it. That's the only cases that I have actually known to be related to Munchausen by proxy. But unfortunately, I think there's a lot of more cases out there. We just are not aware. So the purpose of this Facebook Live, when it ends, and please again share it with your Facebook community, your IG community, look at it again. Recognize that there are certain signs that we know are often associated with this condition. Either if the person has Munchausen themselves, so they're creating these self-harm conditions themselves, or if they're listening unto a child and creating these conditions. Okay, I think that's all that I wanted to state. Oh, one other thing, usually there are social workers. So for my social workers out there, I had a few social workers that contacted me about this, a few social workers that stated that they've had more than 5. I think one social worker said she had more than 5 cases in her career of Munchausen by proxy. So, there are certain fields that are likely to see this more than others. And again, psychiatrists, mental providers, social workers, pediatricians are more likely to see Munchausen by proxy than any other family medicine doctors, than any other medical or other career fields. And I think that's all I wanted to talk about. I didn't want to extend it even further. I'll be repeating myself. But I'm very passionate about mental health. I'm very passionate about helping people. So I really wanted to talk about this, especially because people are looking at the Gypsy and Dee Blanchard case. So again, thanks so much for joining. I'm just going to do one more run through to see if there's any questions. I don't see any. So I appreciate you listening. Thanks so much for everyone who's tuned in. For those of you who suspect someone who may be dealing with this condition, suspect that they may be invoking this condition onto whoever they're caring for, whether it be a child or a loved one. If you want to learn more about how to prepare for getting help, a guide, I do provide a guide for you. There is a guide that I will send to your email. If you can either inbox me or put your information below, I'll make sure that you get this information. It'll be sent to your email. And it's basically tips that you can actually discuss with the doctors, questions that you can be prepared to be answered with a physician, what to look for if you're suspecting that this is a condition from a friend or a loved one, and how to prepare for that appointment if you're accompanying that person, or if you yourself may have this condition or suspect that this condition. There's information in this guide for you as well. So I'll be sending that to those who desire it. If you are following me on Dr. Dawn Psych MD, it'll be in the notes section on my Dr. Dawn Psych MD on Facebook, IG on Facebook. And that's all I have. So I'm Dr. Dawn Psych MD, your most influential double-boarded child, adolescent, and adult psychiatrist. I'm also an internationally recognized ADHD expert and acute mental health strategist for mental health athletes. Thanks so much for joining me. Please share this with your Facebook communities. If you're not live and this is a replay, please share and ask away your questions. I will definitely address them. Until next time, I'll see you next week. Talk to you soon. Bye-bye.